Welcome to Mental Health Colorado's 2017 Legislative Education and Advocacy Day. I'm Moe Keller, Vice President of Public Policy for Mental Health Colorado, and with me is Plotnick, who is Vice President of Public Policy and Strategic Engagement for Mental Health America National. She's going to begin with a slide presentation on things that are going on in Washington right now with the new congressional effort on replacing the Affordable Care Act, and then I will be speaking after her about the state budget, some of how the federal effort might affect individuals in Colorado, and what some of our challenges are with the Colorado state budget. So with that, I'm going to introduce Debbie Plotnick.
Thank you, Mo, and thank you folks around Colorado and anyone else who is and listening to today's webinar. To start with just a little bit about Mental Health America and why history matters. That's the bell of hope. I think it's very important, and every day we remember where we came from. This was smell shackles and chains that were collected from all around the country from asylums. So when we go out and do our work, we remember that mental health and substance use needs have always been at the bottom of the list of legislative priorities, and people have been treated abysmally. And as I talk about continued advocacy, you'll see why it is important to keep in mind. Mental health philosophy is before stage 4. We're trapped in what we call stage 4 thinking, which is that mental health conditions the only health conditions that as a matter of public policy, we wait until stage 4 to treat, and then often only through incarceration. Mental Health America is working to shift that paradigm. Our before stage 4 philosophy has 4 components: prevention for all, early intervention and identification for people who are at risk, integrated care and services and supports for people who need them, and recovery as a goal for all. We started a screening program at Mental Health America, and I'm going to go through this very quickly just to show you that the things that advocates have been talking about anecdotally for many, many years are showing up and proving to be true on our website that we about 2.5 years ago. With no fanfare, we put up a screening site, and thus far, in slightly over 2.5 years, we've had 2 million people come to take our screens. We have, as you can see from this slide, screening for depression, anxiety, bipolar, PTSD, a youth screen, a parent screen, an alcohol substance use screen, and psychosis screen. We think screening is important because it promotes recovery. People who screen regularly are attuned to what's coming, to their symptoms, what they're feeling. They're more knowledgeable about their conditions. The fact that they're screened means they know something. They're better able to communicate what it is happening with them. They're able to recognize improvement and build on it. They're also more aware of warning signs of relapse. They're better able to self-manage their condition and their needs. We know that just at the end of last year, 2016, we had over 2 million screens. People demographically give us, they give voluntarily rather, demographic information, and it closely follows census data as to what the demographics are. We know that just under 2% of the people who screened come from Colorado. That was more than 10,000 screens just last year. And we find that the screeners who took our screens from Colorado pretty much follow national screening. We really find the same consistencies throughout this. The majority of people come for depression, just over half. We know that next, popular in terms of what screen to take is bipolar and anxiety, and then psychosis screens. Now, here's the really important part that we have seen proves what we've been saying. We know that the vast majority of people who come to take our screens, our data bears out that they are young. In fact, more than a third of them are between 11 to 17. More than 3/4 of them are young people under age 35. We know that this is bearing out what we've been saying about mental health conditions show up in childhood and certainly by adolescence. We know that the folks who come to our screens, who take them, are screening positive. Almost 3/4 of people who take one of those screens are screening in the moderate to severe range. And this is information they didn't have before. And most of them, again, 2/3 of them, have never been diagnosed. So we know the need is tremendous. And we're following the same kinds of things. People are taking the screenings and they're finding the positive results pretty much in the numbers taking the screenings. We also know that people who are coming to take the screens, when we ask them about things going on, they almost always have other co-occurring conditions. So this brings us to the where we are and where we must go. And I want to start with just a little bit of a reminder of the legislative process around health care and health care reform. We know that we have the Affordable Care Act, the ACA, which is also known as Obamacare. We know that there's a political will and an effort right now on Capitol Hill to repeal the Affordable Care Act under Obamacare. Here's the process that is going to be used legislatively. It is using a process called budget reconciliation. Budget reconciliation can only affect the pieces of the ACA that have a budgetary effect. Now, what's different about budget reconciliation is that to pass, it only needs a simple majority of 51 votes in the Senate. All other things need a 60-vote threshold. And there's a special rule that's named after Senator Byrd, the late Senator Byrd from West Virginia, that says if parts of the bill that are put into budget reconciliation, if they don't have a budget impact or extraneous, they can either be excluded straight away or they can be voted on the regular rules with a 60-vote majority. So it's very in how this bill may or may not get passed. So a draft bill of the so-called replacement bill, if you will, the new bill, it was kept secret. We saw it earlier in February, but the replacement bill has many similar provisions. In fact, we were pretty clear on what was forth. The new bill is called American Health Care Act. So this would be sort of, if you will, to use the colloquialism, replacing Obamacare with Trump care. The American Health Care Act is the new proposed law. And I'm going to elaborate on what would be in it and what would be different. But first, I'm going to say why Medicaid is particularly essential to people with mental health and substance use needs. Traditionally, and continually, Medicaid has been the largest payer of mental health and substance disorder treatment and services. 31 states, including Colorado, expanded Medicaid. In fact, in Colorado, 400,000 new people came into the Medicaid system getting coverage, and 70% of those folks are employed. So these are people who didn't have insurance who now have it. And 1/3 of Medicaid expansion folks, and this holds true for every state, 1/3 of them has a mental health or substance use need. Of course, Medicaid in the expansion population also covers general health. Proposed changes to Medicaid under this proposed new health law would mean that the expansion would be phased out. Now, states that have not chosen to expand still could until the end of 2019. But after the end of 2020, no new states could join in. Right away, the extra money that came under the Obama, the ACA, the FMAP will go away. It will completely gone by the end of 2019. Very importantly for folks with mental health needs is that this new law would fully repeal the essential health benefits. So it would mean that states could choose what benefits they will cover in their Medicaid law and if they cover them at parity. So they could choose not to cover mental health and substance use services. Unlikely that they wouldn't cover them, but they would no longer have to cover them at parity. It also would repeal something called presumptive eligibility. And that means right now, if someone in a mental health crisis comes into an emergency room, needs to go in a hospital, they would be accepted and they then would be assumed to be eligible for Medicaid, and they would start billing Medicaid from the minute they walked in the door. That would go away under the new rules, except for presumptive eligibility would end except for children, pregnant women, certain types of cancers, breast and cervical cancer. So right now, what are people getting under Medicaid and what would they be getting? After 2020, there wouldn't be any who'd be able to come in under those expanded rules that are based just on income. So it would mean that we'd go back to the bad old days of childless adults who were not disabled or didn't fit into a special category would not be able to get Medicaid, and the extra money that states got would go away. The people who came in while extension was in place would be able to stay, but if they lost that eligibility for more than 30 days based on their income, wouldn't be able to get back in under old rules. And under this new proposal, states would have to redetermine their Medicaid eligibility every 6 months. The big change to Medicaid that is posed in this new Trump administration bill is called capita cap. And that means that beginning fiscal year 2020, there will be a set amount per person. The base year that the amount would come from would be 2016. The set amount per person is based on targeted spending that would come from adding together all the enrollment status that people have, all the different categories. They would figure out what your per person, per capita rate would be, depending on what category of Medicaid eligibility you came in under. Were you older? Were you blind? Were you disabled? Are you a child? People who came in under the non-expansion rules, states have different rules, or the expansion, and so the per capita amounts were different. There would be increases that would come every year too, but the amount each state would get per capita, it would be a raise based on the index of how I have on this consumer price index that's since been modified to the healthcare index, how much the rate across the country things are going up. So it would increase a little bit every year. But if the state in any given year spends in all its categories more than it was expected to spend, then in the following year they would get a reduction in the amount they got per person. Now, things would be a little different too under this proposed health law in the insurance market, the marketplaces. The biggest thing and concern for folks with mental health substance use services, as well as just about everything else, that it would undermine the essential health benefits, which would mean that all plans now are required to cover many different things, including inpatient, outpatient, rehabilitation, medication, substance use, and mental health services at parity. But those no longer be the same. They would be changed in a way that they wouldn't be repealed, it would be in Medicaid. However, plans would again allow to sell insurance plans on the open marketplace that didn't cover those things. And there would be no penalty for doing so. So the penalty for not having them would be zero. So essentially, they would be disappearing as well. There are also major changes in the marketplace to the premium supports that now exist under ACA or Obamacare. Presently, the amount of subsidies depend on how old you are, where you live, and your income. So they would be replaced only based on age, not income, and not geographically. Healthcare across the country are very different, but it wouldn't make a difference under this proposal. It would be a flat tax credit for people who make under $75,000. So over that, they wouldn't get anything, but under that, they would get a flat, if you're under age $32,000, between 30 and 39, $2,500, between 40 and 49, $3,000, between 50 and 59, $3,500, and coverage for people over age 60 would be a flat $4,000. A difference also would be that right now under ACA, Obamacare, insurance can only charge people over 60 3 times as much as it charges younger people, and that would be raised to 5 times as much. Okay, and there were also some changes in income limits, and there are tax advantages, but they're not an advantage for everybody. So there would be full tax credits, the numbers I just went through, for people earning under $75,000. Or households that earn collectively $150,000 or less. No tax credits whatsoever for people making over $215,000 and $290,000 for joint filers. So tax cuts, though, for people with means would be a big part of this, and they're kind of baked into this proposal. So if you have more money, you will be able to take more dollars out of your income that have not paid income tax and be put into either a flexible spending account or health savings account. Now, people can certainly do that no matter what their income is. People with low incomes have less to put in. People with higher incomes are able to take more of taxable income and avoid paying income taxes by turning it over to pay for insurance premiums or co-pays or any kind of qualified medical expense. The other thing that is very important in this new proposal is that there's no way to pay for the tax credits even though reduced. It repeals all of the taxes that we're paying for the ACA, such as the employer tax, medical device tax, and a tax on tanning. There are a lot of different taxes. They are all repealed under this plan. It also would repeal the mandate to have insurance. So the idea behind the ACA was that everyone was required to have insurance. That's how you get shared risk. Well, this shared risk mandate would go away. No longer would people be required to have insurance or employers be required to provide it. However, most people do want insurance. And under this plan, if they don't have continuous coverage and they want to come back in, they would, if they had an interruption for just over 2 months, 63 days, they would get a 30% surcharge put onto that first year's total cost. That 30% surcharge is in effect a tax, but it wouldn't go to the federal government and it wouldn't go to the state. It would go directly to the insurance company. So a lot of people might be expected to not buy any kind of insurance because there's no penalty, and they might wait until they're sick. Then when they're sick and they really need it, okay, for 1 year there would be a 30% surcharge going to the insurance company, but they would be guaranteed buying it because, again, the pre-existing condition limitation would go, that would stay, just like it's in Obamacare now, it would stay in the new proposal, so they'd have to get some kind of coverage. It would be expensive, and it would be 30% more on top of that. And people with mental health and substance use needs are particularly vulnerable for penalties because all too often they have interruptions in coverage. So as I mentioned, the things that are unchanged in pre-existing coverage also is not changing, and young people may also stay on their parents' insurance until they're age 26. But as soon as you hit age 26, during the next open enrollment period, they have to buy something on the exchanges. They would get that $2,000 tax credit to do it, which probably won't cover anywhere near what they need covered. So if they're not employed and they weren't able to purchase it, they would get that 30% surcharge when they would try to get it when they need it. So what do we need to do about this? Well, we really need to add your voice. We need to add everybody's voice. And we need to make it clear why this would hurt individuals, it would hurt families, and it would hurt our community. And what we know are the most effective things to do right now, we have to pay attention with respect to this proposed plan, if you will, Trump Care, is we've got to call our elected representatives in Washington. We have to let them know this is not okay. I have a slide here with Karen Howard. She worked with me on my team at Mental Health America National, and Karen is our advocacy manager, and she's a former congressional staffer. She has worked for several representatives on the Hill, most recently Steny Hoyer of Maryland. And Karen says that the most important thing you can do is call, pick up the phone. Other things are important too, but it's that phone call. And you're most likely to get through to, even though it's your national representative, you can call them in Washington, but you can also call a regional office, and you may be more likely to find the phone lines less jammed if you call there. But nonetheless, call them. If you don't know who they are, go to the website, www.house.gov, and you'll find by just putting in your zip code who your Congress people are. That's on the House side. This proposal is going to first go to the House of Representatives for the vote. So right this minute, it's essential to call the House members. And you can, from the slide, Karen's done a little script for you. Tell them your story. Tell them you live in the district. Tell them why it's not a good idea for your family or your community. Can also put it in writing. And one of the most important things that has just gone into writing, we offer our heartiest thanks and congratulations to Senator Cory Gardner of Colorado and his colleagues, Rob Portman, Shelley Moore Caputo, and Lisa Murkowski, who are all Republican senators who stood up to their leadership in the Senate and said, this bill's going to hurt people. And in their letter, they specifically said it will hurt people with substance use and mental health needs, which in fact it will. And they reminded their colleagues, as you can too, when you call and say that the Congress has just passed sweeping mental health and substance use legislation last year called the 21st Century Cures Act. It was something that was shepherded along and in large part is due to the wonderful efforts of Colorado Congressman Diana DeGette. And if these changes happen, many of the provisions of 21st Century Cures will not be able to happen because people won't have coverage for the types of things in there. So tell your not only Congress people, but tell your senators and call senators like Senator Gardner and say, thank you for standing up for mental health and substance use disorder. We at Mental Health America have been writing letters too, and we had our affiliates join in. So it's coming from our national and our local representatives together, and we've sent it to every member of the Senate. We have also, of course, been writing, calling, and visiting the House members, but it's most important they hear from you, and they hear from you in district. I live in district, and I need to hear from you. So this is a picture of me. And this is a picture of me telling some important people on Capitol Hill what I think and what I think about how this is going to hurt people. The people in the panel sitting there are Congressman Frank Pallone of New Jersey, and he is on the Energy and Commerce Committee. He is the minority chair of Energy and Commerce, which is one of the committees of jurisdiction for any changes to health care law. Mrs. Pelosi, Nancy Pelosi, who is the former Speaker of the House, she's currently the minority leader in the House, is in the middle, and sitting next to her is Representative Bobby Scott of Virginia. And his interest in mental health and substance use comes from his high position on education in the House. And I'm telling them I'm telling them why it matters. I'm telling them personally. I'm telling them my family story. I'm telling them how when my daughter was an adolescent, she showed serious signs of depression. She had what her family felt like would never end, with 4 years of being suicidal, very difficult. Our family in pre-parity days did everything we could to get help and services to help our daughter. We were lucky that we had some really good credit and the ability to find help for her, but that isn't the case for a lot of folks. And it certainly wasn't before we had the Affordable Care Act, before Obamacare. And my personal experiences are what really directed my policy career and what makes me an advocate and why I fight so hard. So we let people know that it really matters. We tell that story. My daughter is doing terrific. She's back in Colorado, is a happy Coloradan who is about to make me a grandmother, and I'm thrilled. When I told that story to Mrs. Pelosi, she was very happy to hear it. And my understanding from her staff is that personal story and that one matters her so much that she leads with mental health, and she says why it matters, and she thinks about people who it affects, and when they got help, what a difference it made. I also told her about my experience working in the field and working with people at our Mental Health America affiliate, where I oversaw many programs from people who may even have gotten mental health services through the county and through the state, but before Medicaid expansion couldn't get the rest of their health needs covered. And if you'll remember from our slides about screening, people almost always have co-occurring conditions. And people who have been in the public mental health system have been there a long time, and they always have other serious conditions. Medicaid expansion helped people who were getting mental health services get the rest of the care they needed, and it helped people who weren't able to be reached before, and it brought parity. So other families didn't have to struggle like mine did to find the funds to help their loved ones and to almost go bankrupt. It's always personal. That's a picture of me and my lovely daughter, Ashley. And remember, when you tell your story, make it personal. Tell your elected representatives. Right now, call the House of Representatives. Call your senators. Tell them it's essential that they do not allow the proposed law to take away Obamacare. Tell them you like Obamacare. Tell them you don't Trump care. If you need to put it in terms that simply, that's just fine. They know what you're saying. So please stand with me on strong advocacy. And feel free to contact us at Mental Health America. We're there to help you. Thank you so much.
Thank you, Debbie. That was wonderful. We really appreciate your coming here from Washington to be with us today on our Legislative Education and Advocacy Day. For those of you who not know, Mental Health Colorado is the state affiliate of the National Mental Health America Association, and we're proud to be associated with you and proud to continue the good work of Mental Health America. We have been in Colorado since 1950. is when we, and so we have been affiliated then. So what I would like to focus on my part of the presentation here is why money matters. I'm going to spend just a couple of slides on bringing down what Debbie was talking about at the national level and bringing it down to how does it affect the state, meaning not just the state budget, but citizens in our state. And then I'm going to go on and talk about state constraints when it comes to spending money. Why is it that we are having such difficulty when we know we need to do the right thing when it comes to spending and investing monies in mental health and substance use disorder, and what prevents us from doing that? So the first thing that we know is that one thing that Debbie mentioned is that the current proposal before Congress right now is all about saving money and slashing money and shifting the cost of Medicaid from the federal budget down to states. So when they're looking at a new formula and get rid of the Obamacare formula in 2020, it means a $1 billion cost to the state of Colorado in our budget, because they're lowering their match rate, and that means that the federal government is shifting that cost to all the states. For us, it's $1 billion a year to make up for the Medicaid cuts that the current legislation before Congress is proposing. One of the other things we know that the current proposal before Congress, the Trump Care proposal, requiring is a reduction in the federal poverty level, the income level of families able to qualify for Medicaid. So right now, families making 133% of poverty, which is very low, it's $11,000 or $12,000 a year. That's going to go down to 100%. Now, for the children in these families, the children between 100 and 133% is 64,700 children. Those children, starting in 2020, according to the new congressional bill, will be kicked out of Medicaid. They will no longer be eligible to receive services for Medicaid. We're unclear at this point what that means, where these youngsters might go, what might be something that the state could do to try to cover them in a different way, but we do know that they will no longer be eligible, as they are today, to receive Medicaid. But the most concerning thing for me personally is the requirement, the complete repeal of mental health and substance use disorder as a benefit in Medicaid. And I'm going to say that again. So right now, Medicaid is the largest payer of mental health and substance use disorder treatment and prevention and programs. That's being repealed at the Trump Care proposal. So the Congress is looking at right now is repealing the requirement that Medicaid offers mental health and substance use disorders. Each state has the option of whether they want to include it or not. Debbie is probably right that most states will try to figure out a way to have some of that still offered, but it is not required. And you could have Medicaid in a state and have no mental health or substance use disorder at all. We do know that mental health and substance use disorder affects 1 in 4 individuals in the country, 1 in 4 in Colorado. So when you're looking at a $5 million population, 5 million citizens that we have in our state, you're looking at about 1.5 million Coloradans who will be affected by this particular rule. That repeal of the requirement to offer mental health services, coupled with the reduction in the amount of federal payment for those, means that there will undoubtedly, it cannot be avoided, there will be some pretty serious cuts to not only individuals being eligible for Medicaid, but individuals who are eligible to be able to receive services in mental health and substance disorder. So the state of Colorado has a $27 billion. We have a balance sheet requirement. All the states do. So we're different from the federal government in that we have to balance our budget every year, which is a good thing. But this is $27 billion. Our general fund is made up of monies that come from income tax and sales tax that all of us pay as citizens and business. So that's where that particular amount of money comes from in this pie. Federal funds, you can see, are a substantial amount of money. 32% of our general fund in this $27 billion budget comes from the federal government. That's Medicaid money. It's also transportation money. It's monies for clean air, clean water, monies for summer education programs. And then cash funds are things that we charge a tax for a specifically designated purpose. So the best example is the highway use tax fund, which is the gas tax. So when you go, you put gas in your car at the pump, there's a certain amount of cents per dollar that go into that particular cash fund. That money can only be used for highways and transportation, and that's the cash fund part. So where does that money go? Well, for mental health, we actually spend $900 million of that $27 billion figure on mental health. Roughly is about 1, maybe 2% of the entire budget. It's a lot of money. It tends not to go as far as you might think. So $600 million of that is the Medicaid contracts that go to all the mental health centers, and they provide some prevention, but mostly treatments and programs for individuals who may have a mental health or substance use condition who are on Medicaid. That's that $600 million. $100 million goes to our 2 state hospitals. We have Fort Logan in the Denver area, and we have the Pueblo Mental Health Institute in the city of Pueblo. The Fort Logan has what we call civilly committed. Those are individuals who are in very serious difficulty, who need some residential respite. It could be just short-term care. It could be a little bit longer stabilization. They have not committed a crime. These are people who just simply need that particular residential piece. Pueblo has the forensics, which is the criminal piece. So people have committed a felony offense of some sort. They have been before the court. Some of those folks have been determined not guilty by reason of insanity. Some folks are sent to Pueblo to be evaluated for competency to stand trial and or restored to competency, which can take quite a while. Restoring someone to competency to stand trial can be years. Then about $200 million goes into the corrections, prisons, foster care, other child welfare services and of that nature. So Colorado is the only state in the nation that has something called TABOR. It is an amendment to the Colorado Constitution. TABOR stands for Taxpayer Bill of Rights, and it was passed by the citizens as a citizen initiative in 1992, and we have had it ever since. It had multiple provisions in it, but the 2 provisions that are the ones of concern are that the state legislature cannot raise taxes without a vote of the people ahead of time. Now, that's very popular, and that actually isn't the main problem. The second piece is the main problem, and that is that TABOR has a formula for which the state cannot retain revenues it receives from and use taxes and income taxes. It's above that formula, and the formula is inflation plus population growth. The formula has not kept up with the actual needs of the state. And so in 2017, you can see the bar chart shows that the amount of money above that line is actually about $500 million. These figures fluctuate a little bit as we correct our revenue forecast with revenue that is actually received. But that $500 million, we can do one of 3 things, according to TABOR. We must send it back to people in the form of a tax credit on their income tax for the following year. That's one thing we can do. The second is we can go to the voters in November and ask to keep that money for a particular purpose, which has been done in the past and has mixed results. Sometimes it passes, sometimes it doesn't. Or the third thing is we can cut the budget so that that $500 million falls below the red line, and then we're not faced with either of those 2 other scenarios. However, it does and it is intended to put a stamp on how much money the state can retain and how much it can grow, the government can grow in terms of services for its citizens. And that is a major issue for us. This is one reason why even we have the funds coming in. We have $500 million more year that we could be spending on mental health or other needs in the state, we're not able to because of that amendment to the Constitution. There are, however, two other amendments to the Constitution, also passed by the citizens. So Amendment 23 was passed after it was passed in the late 90s, early 2000s, if I remember correctly. It requires that the state of Colorado pays more every year for schools, inflation plus 1%, if I recall, every year, so that the increase in spending for public schools is required by this amendment to go up every year. At the same time, TABOR is telling us we have to suppress and reduce every year. That conflict has major problems for legislators trying to figure out the budget. As a result, however, we have now fallen by about $800 million less paying for schools than we did a decade ago. Another amendment is the Gallagher Amendment, passed in the 1980s. This says that for local property taxes, the state does not pay property tax. Your property tax on your house that you are paying if you own a house goes to the school district in your county. It goes to the fire district. It goes to the water district, the sewer and sanitation district in your county. Those are basically what the money goes for. Well, the Gallagher Amendment says that no more than 45% of all the property taxes collected in that county can be on the residential side. Now, that's a good thing for all of us who pay property taxes on our homes. That means that we'll never see the majority of the property taxes go skyrocketing. They'll have to be contained. Well, that's fine. We're running up against the 45% limit right now. So what it does, though, is it says the state has to backfill that loss of revenue. So the property tax being capped means that your county, your school district, your fire district, your water, your sewer sanitation are all losing money. So in order for them to be able to continue and not lose that money, the state has to take, and it happens to be about $200 million this year, from our general fund and backfill all of the reduction in the property taxes throughout the state of Colorado. That's a further reduction in the amount of discretionary money that we have to spend on mental health or other things. And then finally, is the senior property tax relief, or the homestead exemption. That was passed in the early 2000s. It was designed to provide for seniors to be able to stay in their homes so that they could have a break on their property taxes, so that they wouldn't have to move to go into a nursing home or anything of that nature. Good program. But it costs about $150 million. It actually could be higher than that this year. All of those pressures and all of those costs are in the general fund that we mentioned earlier, for which we're competing for mental health and substance use disorder funding. So you can see that with these constraints, we are for the same limited dollars that everybody else is trying to access as well for other programs. So what we're up against public health, we're up against transportation, fixing roads, we're up against keeping the courts moving and judicial system. We're up against corrections and public schools, and even economic development. How can we stimulate economic development? There is an argument that might not even be worth it, since the money that comes in we can't keep anyway. So all of that's in play. Now, the one thing that happened recently is the citizens did just a few years ago pass recreational marijuana. And that marijuana tax fund, there were quite a bit of revenue generated from marijuana, multiple kinds of taxes. There are licensing fees for the providers, the stores. There's a sales tax, an extra sales tax, an excise tax, a use tax. There's quite a bit there. Some of that tax money is under the TABOR amendment and does create that amount of revenue above the red line saw earlier. So it is counted towards TABOR, but some of it is exempt. So the voters exempted a certain segment of that new revenue stream from having to be subject to TABOR. And that included this pie chart. So this pie chart, by percentage, you're seeing where the voters said the money from those sales taxes can go. Public health in general, children and youth, and that particular section of children and youth, it is to educate youth about substance use, not using substances, including marijuana, not using alcohol, that kind of thing. It goes into regulations, meaning enforcement of the regulations and law enforcement for the whole industry as a whole. The substance use disorder treatment, so we are finally getting some additional monies for substance use disorder, and behavioral health for offenders. So offenders in prisons and or jails, and actually transitioning out of prisons and jails can also be benefited with some of this new marijuana. So why are we using that money? Well, it's been approved by the voters, and this section is exempt from the TABOR requirement of having to return the monies. We can actually use it. We can actually spend it, even if it's a pretty significant amount. And this is an amazing number to me. $135 million more, almost $136 million, we've actually collected just by the excise and special sales taxes. That's amazing. The total amount of money from all of the medical and recreational taxes for marijuana are actually $176 million. The rest of this money is subject to TABOR refunds. Part, though, $136 million, we are able to use for those percentages in that pie chart. So we have an option here to be able to access revenues that would be available otherwise. The governor has requested $9.7 million of the marijuana tax money to put mental health professionals in the schools. It equals about 150 new mental health counselors in the schools. This money has not yet been approved by the legislature, specifically the Joint Budget Committee, which writes the budget. The Joint Budget Committee is made up of 3 senators and 3 House members. They haven't yet voted on that one. $4 million to reduce jail confinements and enhance the crisis response system. I am happy to say that the Joint Budget Committee did approve that amount. And $5 million that we hope to use to provide housing for people with serious mental illness leaving prisons and or jails, along with community supports. That money, actually, that $5 million has deadlocked on a 3-3 vote in the Joint Budget Committee. We're not sure we're going to be successful in getting that money, unfortunately, but we are trying to continue to call the members of the Joint Budget Committee and say, please vote for that money. We really need to have that housing option to provide stability for people in the community and prevent that high recidivism rate we see of individuals going back into prisons. So a new bill that just came out, and we're very excited about it, this is some really good news, is Senate Bill 207. It is a recommendation from 2 task forces. The first is what we call CCJJ, and that's the Colorado Criminal and Juvenile Justice Task Force. That was set in the legislature more than 20 years ago, been active for a long time. And a task force that the governor set up for this summer and fall, last summer and fall, on involuntary holds task force. Mental Health Colorado served on that task force. And we came up with very similar recommendations, and we put them together. This is a very bold piece of legislation because the first piece ends the use of jails to hold individuals on an involuntary hold when they have not committed a crime. It is not a crime to have a mental health condition. It is not against the law. And yet, our county sheriffs in particular in the rural parts of Colorado have for 30 years now, and they have the statutory authority to do it, have been intervening when they find an individual who is gravely disabled, not taking care of themselves, clearly going downhill medically, or is an imminent risk to himself, maybe suicidal ideation, or potentially a risk to someone else. They're taking those folks, they have not committed a crime, but they're in serious psychiatric crisis, and they're putting them in a jail cell for their safety because there's no therapeutic alternative in that local community. Now, they have the right to do that by law for 24 hours. And to their credit, the county sheriffs have come forward to the legislature last year at this time and said, we don't want to do this. We are not mental health professionals. We feel terrible about having people in our jail cells who don't belong there. We have people who do belong there. We don't want people who don't belong there to have to be there. And they spend the 24 hours that that individual is in their jail cell. The sheriffs are on the phone trying to find an alternative, a therapeutic alternative. They're calling all over the state to find a bed in a mental health center, a psychiatric center, crisis stabilization, whatever, emergency room of a hospital, wherever they can find one, to be able then to transport that individual, and the sheriffs do it, to that location where they can have a person. They are spending 4 and sometimes 5 hours drive one way to get in a sheriff's car to get the individual into a bed in the Denver metro area when they may come from the southwest corner of the state or the western slope of the state. Then they have to do the paperwork, and then they turn around and drive 5 hours back. This is outrageous, and we all agree that we need to change this practice. This bill does change that practice by striking the language in the state statute that gives them the authority to hold someone for 24 hours. Now, that is a great thing, but if we're going to do that, we better have therapeutic alternatives in those local communities for which the sheriffs can take them to instead of the jail. It isn't going to work if we just do the one part. So the second part of the bill improves our currently up and running crisis response system to provide those alternatives. And it also provides for local communities to do local agreements and build upon whatever strengths and whatever resources they have in that local community to be able to use those local resources. That cuts down on the drive time, it cuts down on the jail's use, it cuts down on having to build something new or try to get psychiatric beds in the Denver area when we really need them in the local communities. So the good news and the exciting news about this is that this particular bill, 207, has tremendous support all across the legislature. Both political parties have embraced it. Everyone, I can't say every legislator will vote for it, but it will have a preponderance of the majority voting for it because they know that we need to change this. And we have the best news of all is that the Joint Budget Committee did approve $7 million for this particular effort. This bill will be up before the legislature. It'll be in the Senate Judiciary Committee on March 22nd. If anyone listening to the webinar is interested in either submitting a letter, calling the legislative members of that committee and asking for a yes vote, or for actually testifying on that bill and for that bill, you can let me know, Moe Keller, and my email address is mkeller@mentalhealthcolorado.org. And I'll get you connected and we can talk about how you can be involved. So with that, we're going to close our webinar on our 2017 Legislative Education and Advocacy Day. Thanks again to Debbie Plotnick from Mental Health America National out of Washington, D.C., and Mental Health Colorado, the state affiliate here in Colorado. Thank you.